Hi. So, Dr. Fisher, please tell me about yourself.
I'm an orthopedic surgeon in Indianapolis, Indiana, and I specialize in total hip and knee replacement.
And where did you go to school?
I went to Indiana University School of Medicine and did a fellowship in joint replacement surgery in Ohio.
And why did you choose orthopedic medicine?
Because it's a wonderful field. What I get to really impact patients' quality of life and improve their outcome, their day-to-day activities. Basically, very good at relieving pain and improving function.
Now, Lonnie, where are you from?
I'm from Indianapolis.
Please tell me your story.
I started having joint pain several years ago, gradually progressed, did all of the conservative therapy with the medications, even had the joint injections. Finally went to my primary care physician and then onwards to the orthopedic specialist, Dr. Fisher, and decided that in my case that the knee replacements were absolutely the right answer for me. I can't recommend them highly enough because it really gave me my life back, reduced the pain to minimal amount, able to get back and ride my horses and get on with my life, and just very, very pleased with the results.
Now, doctor, what is osteoarthritis?
Osteoarthritis is a gradual wear and tear of the lining of the joints. Basically, the cartilage that rubs together becomes damaged and progressively deteriorates to where ultimately all the cartilage goes away, the bones are rubbing against each other, and you can have bone loss in addition to the cartilage loss, which can lead to deformities and loss of motion or function of the joint. And the pain that goes with that tends to wax and wane, where some days are good, some days not so good, and then ultimately becomes disabling where patients are no longer able to do things. It affects about 30 million patients in the United States today and will double in the next 15 years.
Sounds like we might have lost her. Stand by and keep your eyes on the camera, please.
We don't have Jason either.
Stand by.
He just said there's a guy out beside the truck with a
Jason,
chainsaw.
can
He
you
just
hear
cut
me?
all the wires. No, I'm just kidding.
Yeah, I think she dropped. Can you see if you can read?
It's not just her that dropped, Edgar. I lost all audio coming from you guys. Have you?
Doctor, can you say hello?
Hello.
I'm going to have. Okay, we're going to try and get her back. We had an audio hit.
Okay.
We got time in the schedule. We'll
Okay.
see if we can get her back on.
Sound like a sunspot.
It's like, man, you snooze, you lose here. You lose your place.
Yeah, you're all right. Please in line.
Okay, Dr. Fisher and Lonnie, I have Michele back. You guys go ahead and take it from the top if you don't mind.
Okay.
Sure.
Okay. Hi there. How are you guys doing today?
Fine, thank you.
Good.
Dr. Fisher, please tell me about yourself.
I'm an orthopedic surgeon in Indianapolis, Indiana, and I specialize in hip and knee replacement procedures.
And where did you go to school?
I went to medical school in Indiana University and did a fellowship in joint replacement surgery in Columbus, Ohio.
And why did you choose orthopedic medicine?
I went into orthopedics. It's a wide range of specialties in this field, but it provides us the ability to really impact patients' quality of life. With what I do, I can relieve pain and suffering, improve patients' functional abilities, and get them back to an active lifestyle.
Lonnie, where are you from?
I'm from Indianapolis, Indiana.
Now, please tell me your story.
I started having joint pain several years ago, probably at least 4 or 5 years ago. Tried all of the typical medicines, braces, even had joint injections. It eventually got to the point where I could not do anything without a great deal of pain, and particularly impacted my ability to ride and train my horses. So I decided that I needed to go get some help, went to my primary care physician and then on to Dr. Fisher.
Now, what is osteoarthritis?
Osteoarthritis is a condition that affects the joint surfaces or the cartilage that rubs together when you put a joint through a range of motion. As that deteriorates, then the bones start to rub together and cause increasing pain and loss of function. It's a condition that affects 30 million Americans, and the numbers of patients who are going to have arthritis in the next 15 years is expected to double that number. So it is a condition that affects a lot of people. The symptoms early on are fairly mild, but it can progress rapidly or more slowly over time to cause swelling, pain, giving way of the joint, and ultimately loss of activities, whether it's sporting activities, social activities, working activities, or activities of daily living. As it impacts patients, the treatment options that we have range from medical treatments to surgical treatments, with a surgical treatment ultimately being a total joint replacement.
Now, how could you determine if knee pain is due to osteoarthritis?
X-rays are the best way to determine that, but the clinical history as well as the examination and X-rays are needed to determine this. So that's the most important thing. In a survey that was sponsored by DePuy Synthes that included over 500 women who had either had joint replacement or were about to, this study looked at their symptoms, and these people had had symptoms for a long time, ultimately leading up to where they had actually given up some of their working time in the 6 months prior to surgery because they were so disabled.
Now, who does osteoarthritis typically affect? Is it usually women?
No, osteoarthritis can affect anyone. Certainly men and women are equally involved. They can start developing symptoms as early as their 30s, and ultimately throughout their life the chance of developing arthritis increases, with about 1 in 6 patients having some form of arthritis somewhere in their body.
Now, what are the treatment options for osteoarthritis?
Treatment options early on might include medications, it might include physical therapy, it might include intra-articular injections or the use of braces. As those lose their effectiveness and ability to provide pain relief and improve function, joint replacement becomes the ultimate solution to the problem.
Now, is joint replacement frowned upon, or are people afraid of it?
No, I don't think so. It's a widely accepted form and probably the most successful surgical procedures that we have in terms of improving function and in providing pain relief. So it's very common. In fact, over 700,000 people are going to probably have knee replacements in this country this year.
Now, please tell me a little bit more about the study.
This survey, as I mentioned, involved women 45 to 65 years of age and asked how it affected their quality of life. And most of these women said they had to put their life on pause while they were dealing with the symptoms and as it affected them more severely. After the surgery, 4 out of 5 of these women stated that they wished they had done the surgery sooner. So it clearly has an impact, and that's what I see every day in my practice, And I think that's what Lonnie's experienced with her hip and knee replacements.
Where can the survey be found?
Patients can learn more about this condition and treatment options at the website timetohitplay.com.
Now, why do people typically wait such a long time before choosing replacement surgery?
Well, in the past, I think we've tried to put it off until patients were elderly. The reality is that the relief is durable. The pain relief and function of these implants is so good that many people that develop arthritis in their earlier years, in their 40s and 50s, they lose so much function they don't want to give it up, and they want to get it back. And so the surgical technology today is so good that we can provide improvement in function and pain relief to those patients that is durable and long-lasting.
Now, what are the risks of this surgery?
There are significant risks of any surgery, certainly anesthetic-related risks. With regard to joint replacement, we are concerned about blood clots in the legs, so we use blood thinners in many cases. Infection is a small risk, but certainly one that we are always concerned about. So each individual patient's a little different in terms of their risk profile, and that needs to be discussed with their orthopedic surgeon.
What are the benefits?
The benefits, I'll let Lonnie speak to that.
I was going to say the benefits just are, I can't even begin to tell you. You can do all of the things that you were able to do before your joint started hurting. You can get back to whatever activity you were doing. For me, riding, jumping, training horses, I just can't begin to tell you the relief and the mental relief that it gives you too, from alleviating the chronic pain that you're under.
Now, how old are you, Lonnie?
I'm 58.
Okay. Now, how can people connect with you both if they have questions?
I believe the best way is to go to the website, timetohitplay.com. That will give them more information and other connections that they can utilize.
Repeat the website name one more time.
timetohitplay.com.
Thank you so much. Hope you guys have a great day.
Thank
Thank
you so
you.
much.